Welcome to Deuk Spine Institute. I'm Dr. Ara Deuk-Majan, CEO and founder. September 19, 2024. Our patient's from New Jersey. He presented with facet joint pain. We just completed the Deuk plasma rhizotomy, 4mm incisions, both sides, and we got rid of the pain from the facets, L344551. Next, we're treating his SI joint, sacroiliac joint. You can actually kind of see the joint right and left. We call it the sacroiliac joint. It's where the tailbone connects to the hip bone. And lots of people get pain here from injuries to the joint. The injuries cause inflammation. We'll be making a single incision on each side, and I'll be deadening the pain nerves with my Deuk plasma wand. Let's bring the fluoro in. If you have questions, feel free to ask them. Sacroiliac joint pain is probably the third or fourth most common cause of back pain. That's perfect. So you want to try to be medial to the iliac bone. Right about, one more. Right about there is perfect. Right over the foramen. We'll just make some injection of numbing medicine to the skin. Remember, the medicine we're using is not numbing the nerves, it's numbing the skin. And it's numbing the tiny little nerves in the skin. I'm going to make my 4mm incision again. And then I'm going to use my wand to deliver plasma to those pain nerves, to the joint, in the back of the joint, and destroy those pain nerves. Now, we don't go to the front of the joint, we always stay in the back. The back of the joint is safe. It's really impossible to hurt the patient if you're in the back of the joint. But there is a ridge shot. And if you look here, show us the foramen. You can actually see the foramen. Yep, there's one below, right below that, down a little bit. Yep, there, show that, yep. And that is the posterior foramen. The anterior foramen, which are in the front of the bone, are big. Yeah, they're much bigger. And we're not going to go through the anterior foramen or the posterior foramen. We're going to stay just lateral to those foramen. Is this a new one? Shot? If you have questions, feel free to ask me.
At this moment, no current questions.
Shot? That's perfect. Trying to get as medial as I can safely go. Medial means towards the midline, without getting too medial.
We just got a question.
We don't want to end up being inside the foramen. That would be bad. I will take the question. Just give me a second.
Not a problem.
Shot. Let's see where this is. Okay, so I'm just outside the foramen. Shot. Just lateral. Almost done. No, we have to do the right side. But I will take the question.
This question is coming from Todd on YouTube.
Hi, Todd, on YouTube.
Asking, can the Deuk laser disc repair be used for a bulging disc or only for herniated disc with an extrusion?
Todd, that's a great question. So to be clear, the Deuk laser disc repair works for all disc injuries, from disc bulge, disc herniation, disc protrusion, disc extrusion, disc rupture, disc slip disc, degenerated disc, spondylitic disc. Any disc injury, the Deuk laser disc repair is the best treatment in the world by far, and it works great. We've used it on every type of disc injury there is. Bulging disc, protruding disc, extruding disc, ruptured disc, slipped disc, herniated disc, any kind of disc injury. And it gets rid of 99.6% of the pain from the disc. All right, so I'm just below the foramen there, right, Jordan? I want to get a little bit more lateral shot. That's too lateral, but not terrible. There is a little ridge. We like this ridge. It's a ridge of bone, and the nerves run right over it. The pain nerves, that is. We're not destroying good nerves, we're destroying bad nerves. Okay? Think of this procedure as destructive to bad nerves. That's what it is. It's destructive to bad nerves, not good nerves. 1 minute, we'll be done. Any questions? Feel free to ask. We're almost done.
No current questions, but we do have a comment from Todd once more on YouTube saying, wonderful answer, thank you.
You're welcome. Yeah, Todd. Todd?
Correct, Todd.
Todd, there's a lot of, unfortunately, misinformation out there about these disc injuries. Shot? You know, people think there's a big difference between everything, but they're all the same. They're just different degrees or different names for the same thing, unfortunately. Okay, you can see 4mm incision. We lost the whole case, maybe, I don't know, 20 drops of blood, 20 drops, and we've just eliminated all the pain he's going to have in this area, both SI joints and 3 facet joints on each side. And he's going to go home in 30 minutes. Thank you, everybody. Great job. If there's no more questions, we can end the broadcast.
We have one final question coming from Ping on Facebook asking...
Ping. Yes. I was wondering when you were going to come in. Right at the last moment before the door closes. I love it.
Asking if I'm getting my cervical done, would adding on a disc in the thoracic... It was 6,000 euros to add on a disc, if I remember rightly, but I'm aware you cannot do them both at the same time. Thank you.
Ping. Great question. I don't know the answer. 6,000 seems a little low. I don't know, though. But if you've been talking to somebody at Duke Spine Institute, contact them and ask them. They will give you everything. But remember, you got to get me to agree that you need that done. So we need to do another telemed, and I need to see the disc, and I need to make sure that fixing it's the right thing for you, because money doesn't matter. We don't care about the money. We care about you getting better with our treatment. And if we're doing treatments that don't make people better, that don't fix their problem, then I'm not happy about that. It's not something I want to do. I want to make sure whatever treatment you think you need, I agree with you, and then we can figure out what the pricing is, okay? So talk to your scheduler, your representative, and let them know you're thinking about that, and I'm happy to do that if that's necessary, medically necessary. Have a nice day, everybody. Thanks, Henry.
Of course.